Welcome to this training on telehealth laws for associates and trainees in California. Over the past few years, telehealth has become a central method of service delivery, and many associates and trainees have questions about whether they are permitted to provide counseling services through this modality. This training will clarify current laws and proposed clarifications related to telehealth practice and supervision. Let's begin by defining who we're talking about. Associates are individuals who have completed their master's degree and are registered with the board to earn supervised experience hours toward licensure. Trainees are students still enrolled in their master's degree programs, completing their required practicum experience. Under California law, associates in marriage and family therapy, social work, and professional clinical counseling are permitted to provide services via telehealth. For marriage and family therapist associates, known as AMFTs, and MFT trainees, the law is explicit. Section 4980.43.3I of the Business and Professions Code states that an associate or a trainee may provide services via telehealth that are within the scope of practice outlined in this chapter. For associate clinical social workers, ASWs, and associate professional clinical counselors, APCCs, the law is not worded as directly. Their practice acts are silent on telehealth. However, these associates are still authorized to perform services via telehealth under Section 2290.5, which defines a healthcare provider to include anyone licensed under the Business and Professions Code, along with AMFTs and MFT trainees. Because the code also defines licensee to include registrants such as associates, ASWs and APCCs are covered under this definition, even if not explicitly listed. In other words, AMFTs, ASWs, and APCCs are all permitted to practice via telehealth. Still, because AMFTs are named specifically and others are not, the board has pursued an amendment to include ASWs and APCCs in the explicit definition of telehealth providers to reduce confusion. The takeaway is that all associates registered with the board, AMFTs, ASWs, and APCCs, are legally allowed to provide telehealth services under current California law. Now let's discuss trainees. The law currently specifies that MFT trainees may perform services via telehealth. This is written directly into Business and Professions Code sections 2290.5 and 4980.43.3. However, the statutes do not explicitly address whether social work interns or professional clinical counselor trainees may do the same. These trainees are not registered with the board and are therefore not included under the definition of licensee that applies to associates. This has led to ambiguity around whether social work and counseling trainees can legally provide telehealth services as part of their practicum. While MFT trainees clearly can, the same cannot yet be said for other pre-degree students. The board has discussed whether it would be beneficial to explicitly include social work interns and PCC trainees in the statute to ensure clarity and consistency across all disciplines. Another important topic is the definition of face-to-face hours within practicum and supervised experience. Both MFT and PCC degree programs require students to complete a specific number of face-to-face hours providing counseling to individuals, couples, families, or groups. The relevant sections include 4980.36 and 4999.33 for in-state applicants, and 4980.78 and 4999.62 for out-of-state applicants. However, the law does not specify whether face-to-face must occur in person or if telehealth interactions count toward these hours. During the COVID-19 pandemic, many programs adapted to telehealth out of necessity, but the question remains whether this flexibility should be made permanent. The board has suggested clarifying this in the law, either by defining face-to-face as in-person only or by allowing a portion of these hours to be completed via telehealth. For associate clinical social workers, there is also a face-to-face requirement for post-master's experience. Business and Professions Code, Section 4996.23, D2, requires at least 750 hours of face-to-face individual or group psychotherapy within the 3,000 total hours of supervised experience needed for licensure. Just like with trainees, it is unclear whether these hours can include telehealth sessions or if they must take place in person. The board has proposed that this language also be clarified. However, Section 14132.725 of the Welfare and Institutions Code is amended to read B. 1. Subject to subdivision, K. In-person, face-to-face contact between a healthcare provider and a patient is not required under the Medi-Cal program for covered healthcare services and provider types designated by the department when provided by video synchronous interaction, asynchronous store and forward, as defined in subdivision A of Section 2290.5 of the Business and Professions Code, audio-only synchronous interaction, remote patient monitoring, or other permissible virtual communication modalities when those services and settings meet the applicable standard of care and meet the requirements of the service code being billed. B. 1. Subject to subdivision. K. In-person, face-to-face contact between a healthcare provider and a patient is not required under the Medi-Cal program for covered healthcare services and provider types designated by the department when provided by video synchronous interaction, asynchronous store and forward, as defined in subdivision A of Section 2290.5 of the Business and Professions Code, audio-only synchronous interaction, remote patient monitoring, or other permissible virtual communication modalities when those services and settings meet the applicable standard of care and meet the requirements of the service code being billed. As defined in subdivision A of Section 2290.5 of the Business and Professions Code, audio-only synchronous interaction, remote patient monitoring, or other permissible virtual communication modalities when those services and settings meet the applicable standard of care and meet the requirements of the service code being billed. Basically, that means that Medi-Cal, California's Medicaid program, says that a doctor or therapist doesn't have to meet with a patient in person for certain covered services. When laws like this redefine face-to-face to include video-based contact, it creates the legal foundation for the BBS to extend that same interpretation to trainees. In summary, all board-registered associates, AMFTs, ASWs, and APCCs are permitted to provide services via telehealth under existing law. MFT trainees are also authorized to provide telehealth services, while the status of social work interns and PCC trainees remains less clear. While the law appears to be in favor of allowing all trainees to engage in telehealth during practicum, clarification in the statutes would ensure uniform understanding and compliance across disciplines. Clear language would help universities, supervisors, and registrants determine how telehealth hours may be applied toward practicum and licensure requirements. The board continues to encourage open discussion and stakeholder feedback to guide these updates, with the goal of maintaining high standards for supervision and client care while reflecting the evolving realities of telehealth practice. You can contact the board online at https://www.bbs.ca.gov/about-contact-us, HTML.